Hi, everyone. Thank you so much for joining us. I am continuing the Cesarean Awareness Month video series with some experts that I think you guys will really benefit from in your either planning your cesarean or in your postpartum journey. And tonight I am so excited to be speaking with Anita Arora. She is an infant feeding specialist, and we're going to be talking all things cesarean recovery and planning in regards to how you're going to feed your baby, whether it be breast milk or it's formula. And there really isn't enough information about formula feeding. And there's moms probably right now that need the support with breastfeeding because of the pandemic. So this is a great time for us to be speaking about this. And I'm so excited. So Anita, tell everyone who you are and what you do.
Okay, thank you for having me. So my name is Anita Arora, and I am an IBCLC, which is an International Board Certified Lactation Consultant, but I call myself an infant feeding specialist. I call myself that because I want people to know that I support parents who are breastfeeding, chest feeding, but also bottle feeding, whether that's pumped milk, whether that's formula, and introduction to solids. And part of that is because of my own journey. I am a mother of two babies born via cesarean. So when my first was born, I had a baby who was a non-latching baby. I did not have enough milk. I did have to provide my babe with some formula, and I felt very judged through that process.
Oh yeah.
And I felt like I will never make anyone feel the way I felt.
Yeah. And I think you may also have put a lot of pressure on yourself, right? And so you don't want anyone to ever feel like you made yourself feel either, because that is, I think, the biggest one is what we feel about ourselves, how we felt about birth.
Mm-hmm.
And then the next thing is feeding your baby. So there's so many openings for us to feel guilty about something as a mother, right? So I love that you want to support moms. And so what is it that you can offer someone when they're seeing you in your practice?
So again, it's about helping parents to kind of understand if they're breastfeeding, kind of, the biggest thing that I see or want to educate people on is that it's not normal for it to hurt when you're breastfeeding, and it's not
Right.
normal for you to have cracked and bleeding nipples when you're breastfeeding.
Right.
At the same time, you shouldn't have a baby that's having to feed 24/7 if you're breastfeeding.
Yeah.
Often people think, oh, well, that's just what breastfeeding babies do. And yes, they
Right.
feed often, but if
It
they're
feels like
feeding
it.
all the time,
Yeah.
then
It feels
it's
like it.
something else, right? It's a supply issue. It may be a tongue issue. So
Right.
kind of assessing that tongue function to make sure there's not something going on like a possible tongue tie. And again, that plays into bottle feeding as well. So a lot of
Oh
people think tongue
yeah.
ties are a breastfeeding issue alone. Yeah,
No.
no, they are
It's a
absolutely a
feeding
bottle feeding.
issue. Yeah.
Absolutely. And then sometimes it doesn't actually get addressed, or people don't know about it until they start solids actually. And then they realize that
Yeah.
issue. So again, even with bottle feeding, it's about teaching parents how to appropriately bottle feed, because there are ways to do that that make it work for both you and babe, and make sure that we're not overfeeding babies. Amounts, nobody knows about that. How much do I feed my baby? How does it change? Everybody's used to like those big giant 8-ounce bottles, and they think that that's what their baby will take right from the get-go, which
Right.
they do not. And in
Yeah.
fact, they never really take that much.
Yeah.
And then even when you start solids, there's so much misinformation out there. When do you start? Do you do baby-led weaning? Do you do purees? Do you do both? Like, there's just
Yeah.
too much information. So my job is to provide parents with information, evidence-based information, and then they can make an informed decision. Whatever their decision is totally
Yeah.
their decision. My
Yeah.
goal is their goal.
Yeah. And you want people to feel supported, because, especially healing after a cesarean, when you're already so focused on the fact that like you can't move, you can't go and just pick up your baby when they start crying those first couple of days or first week or two. And it's so frustrating to feel like your body is just like not working, or it didn't do what it was supposed to do. And all these stories that we tell ourselves, especially when wasn't the birth that you had planned. It wasn't the birth that you had desired, and the way that you thought your baby would come into this world. You think that, feeding your baby is supposed to be something that is natural and that everyone should be able to do it. And in a perfect world, yeah, because like, who
Mhm.
wants to spend extra money? Like, I guarantee there's a lot of people who would prefer just whatever is easiest. And for some people, it is just, feeding formula. And others, it's whatever the baby will take or whatever they can handle in that moment. And if they don't have the extra money, but they're not getting the support for any kind of, breast milk or breastfeeding, they're really stuck there because, like, for a single mother or a very low income family, they can't afford all this formula all the time. And, so I think that there's definitely some groups of people out there that need more support than others. And I'm glad that they're able to get that now online. But being able to go to someone's home or do a phone consultation, to be able to help give them that support to make the decisions that are right for them and their family, what makes sense for them, and not what, they think is supposed to happen or what they think is expected of them, or, having family members like, judge you or make comments or anything like that, right? Like, I feel like it's so easy to go down a cycle of not feeling like you are achieving what you're supposed to be achieving.
Absolutely, absolutely. And I think like, you hit the nail on the head when you said that, especially when you've had a cesarean birth, because you almost feel like, you failed at birth. And
Yeah.
so you think, okay, well, now I have to make everything else perfection.
Hmm.
And I know personally, that's exactly how I felt. I was like, okay, breastfeeding has to be 100% now. And then when it
Yeah.
wasn't, I was like, gosh, I can't even do that. Like I suck
Yeah.
as a mother, I can't do
Yeah.
anything. And
Yeah.
so you're right, putting that added pressure on ourselves. And then, yeah, recovering from major abdominal surgery and having to take
Hmm.
care of a newborn.
Yeah. And
There's so many.
possibly other kids.
Absolutely.
Yeah.
So, it's physically challenging, it's mentally challenging. And then, like you said, when there's not the support there, or when the support may be there, but it comes with judgment,
Yeah. Yeah.
that's just terrible. Yeah.
Yeah. Yeah. And so are a lot of IBCLCs seeing people in person yet, or are they doing a lot of like telehealth online? And how is that for you to be able to assess and diagnose certain feeding issues for you to be able to then refer on? And
Yeah, so it's different for everyone. For me, I'm doing everything. So
yeah.
I am still seeing people in my clinic, and I am also going into people's homes. Obviously, because of the pandemic, we are obviously following all the protocols. So
Yeah.
everybody's screened, we all wear masks, everything is
Yeah.
cleaned,
Yeah.
that kind of stuff. So yes, for some people, they really benefit from that in-person support, and being able to just like even in terms of like bringing a scale and seeing how much the baby weighs.
Yeah.
Because
Yeah.
like you said, you didn't see your doctor like till 2 months postpartum, which is awful. It's
Yeah.
ridiculous. And I have
Yeah.
people who are telling me, like, when I ask them, like, do you know how much the baby weighs? And they're like, well, I stood on my scale with my baby and then I stood by myself. I'm like, that's not an accurate weight. So, um,
No, especially
yeah,
not when you're counting ounces with a newborn.
exactly. I mean, especially when we know
Yeah.
how much our weight can fluctuate from day to day. So, that's very concerning to me. So for some
Yeah.
people, they really would want that reassurance. But for others, who aren't comfortable with somebody coming into their home or going to see someone, there is virtual support. And we've really learned how to pivot in this past year. So
Yeah.
virtual support is actually really beneficial. And even when I see people in person, I'm very hands off in my practice. So I don't
Yeah.
do a lot of like, let me latch the baby for you and let me do
Right.
this. I do a lot of verbal guidance, because
Yeah.
my goal is to empower you as a parent to be like, oh, okay, I know how to do this. I got this,
Yeah.
and
Yeah.
build that confidence. So again, I can do that virtually as well. And I've even had parents, like again, last year at this time, we were only doing virtual support.
Yeah.
Um,
Yeah.
yeah, and I've taught parents how to do their own assessment of a baby's tongue, and
Yeah.
really like learn about how to do the tongue function. And actually, that
Wow.
feels very empowering for parents too, because they're like,
Yeah.
oh, I'm part of this.
Yeah.
Um, So yeah, so there's all types of support. It's different for everybody, but for myself, that's the type of support I'm offering, as well as telephone support too, if people just
Yeah,
want, questions like that.
questions.
And
Yeah.
yeah, yeah.
I think like when someone's very hands-on as far as, their assessments, it can make the parent feel like, oh, I'm not holding it the way they held it. And then you start comparing to how you, the professional, did it. It's like someone being like, oh, I try to get my husband to massage my neck, but it's not the same. I'm like, because they're not professionals. They're not a massage therapist. Like,
Totally.
hello. And so I think that it's really great that you don't do that, because I know for myself last year, I had to do a virtual one as well. And there was a diagnosis of tongue tie, and then had to go down that road of getting it released and being locked down everywhere. And it was pretty scary. But I actually had the hookup because I know some midwives, and one of them, dropped one off to me that she wasn't using. So I actually, I could have ordered one off of Amazon if I had the extra money at the time, but what was I going to do with it after, right? So I was lucky that I was able to measure my baby, but for sure, I feel like that would be a really important session to have you come and weigh their baby and give them that reassurance, because you may feel, because it's more of an intimate setting, they may feel more comfortable with you coming in than them even going to their doctors. Like a lot of doctors are doing the support on the phone and, saying, call me anytime you have questions, which I actually found really great. Like I never talked to my doctor that much before, and she was constantly checking in with me. So I felt like I got really good care in that way, but things are definitely shifting a little bit, but I still feel like a lot of practices are not in person yet. So having you there to coach them, to develop that relationship, I think is really important. Let's talk about cesarean planning. I was speaking with someone recently in the last year, and they were talking about having a plan for how you're going to feed your baby, or how you would like to feed your baby, so that you're not just kind of like thrown into it, whichever way your birth went, and then now you're trying to figure out what you're supposed to be doing, and you're trying to now find the professionals while you're in the moment. So having more of a plan for recovery for how you're going to feed your baby. Do you ever talk to patients about stuff like that, or do you recommend that?
So, I mean, I do often teach like a prenatal feeding class where we will talk a little bit about like the different options. Again, we do talk about like, obviously for a lot of people, they may not know they're having a cesarean birth.
Yeah.
So, it's kind of like, okay, this is what may happen in a vaginal birth. This is may happen in a cesarean birth. And then talking about things like, if you do have a cesarean birth, expecting that your milk may be a bit delayed to come in.
Yeah.
Again, we still, I talk about how the milk comes in through that hormonal shift. And even with a cesarean birth, you still do have that hormonal shift. It's not that it doesn't happen,
Yeah.
but it can be delayed. But that can
Yeah.
happen with a vaginal birth that's quite traumatic as well.
Oh
So
yeah. Oh yeah.
yeah. Yeah. So again, it's more about then, okay, well, what to expect in those early days. What do we do if we're suspecting that maybe the milk isn't where we need it to be and our baby isn't getting enough? What are our options? Do we need to start supplementing? Are we supplementing with pumped milk? Are we supplementing with formula? How are we supplementing? Are we going to do a bottle? Are we going to do a cup? Are we going to do a tube? And again, it's going to be different for everyone and whatever's going to work for them.
Yeah.
And then talking about like the biggest thing I think for a lot of cesarean parents is positioning after
Yes,
cesarean
that
birth.
was one of the questions that we had actually, was how to latch your baby in the different positions.
Right. So again, obviously like you said, you're recovering and you're sore and it's very hard to even move your body. So a lot of the times, a lot of parents will be shown a football position post cesarean. I'm gonna be honest with you, it's really not my favorite position. I find it to be very
I don't
awkward.
like it. Oh yeah,
Yeah, but it's unfortunately
I
shown
didn't
to
like it.
all a lot of parents who've had cesarean births, and again, a football position. I have some props here, so I'm going to show you.
Ooh,
I got my knitted breast and my baby.
Oh,
So
I love it.
so a football position is often where a baby comes kind of from the side, and we're literally
Mhm.
holding them like a football, and then
Yeah,
kind of come from underneath. And the reason that they show this position is because they say, okay, well, the baby is going to be nowhere near your incision,
right.
versus in like a typical cross cradle position, where we have the baby more across our body.
Mhm.
There's
Mhm.
chances of them being near there. Now, that being said, I think sometimes people are unaware as to where that incision is.
Yeah.
Yeah, it's not way up
No.
here, right? It's very low.
Yeah.
So
Yeah.
typically I tell people you can still do all the same positions. And in fact, I like to do a lot of what we call laid back breastfeeding,
Yeah.
where you kind of lean back and the baby's more on top of you. And if my baby's across me here, my incision's way down here.
Oh, yeah. Yeah. Just above the pubic bone. Yeah.
Exactly.
Yeah.
So, again, like
Yeah.
that's really, I still think that you can accomplish most positions, even after cesarean. The one position that I do find challenging for a lot of mothers post cesarean is like a sideline position. Um,
Right
you know,
away. Yeah. That's hard.
yes, because when you lie on your side, it's like all your organs kind of just fall over to one side, and you're like, "Is this supposed to be happening?" And
Just
it's
give that
really
one a
not
couple of weeks.
comfortable.
Give
So,
that one a couple
um,
of weeks at least
yeah,
before you try that one.
exactly, exactly. But totally. But again, like really, the positioning that we would show mothers with a vaginal birth is you can accomplish that with a cesarean as well. And perhaps we have to modify it with some additional pillows just to kind of, protect areas and things like that.
So that was one of the questions. I think it's called my breast friend. Is that a breastfeeding pillow? Is that a breastfeeding pillow?
Hmm.
Yeah, someone was asking about
Sorry, I
that.
missed
Like
that. I
what?
think you cut off. Can you do that?
Oh, like I think it's called my breast friend.
Okay.
It's like a breastfeeding pillow. What are your thoughts on that? Should they be bringing that to the hospital with them? That was one of the
Yeah.
questions.
Right. So, I mean, you know what? I'm going to be honest. I don't like breastfeeding pillows.
Yeah.
Why I actually don't like them. And yeah, my breast friend is one of them. There's something called the Boppy, which is another one. The problem with breastfeeding pillows is when you put them on, they traditionally go like around your waist
Yeah.
down
Yeah.
here. And so then this is your breast and this is the baby, but the pillow's way down here. So I
Right.
find most people end up sitting like this because they put
Yes.
the baby on the pillow and
Yeah.
then they hunch over.
Yeah.
This is like so uncomfortable. Like, I mean, definitely they'll be coming to see their massage therapist at that point because they're like, oh, my shoulders.
Oh, yes.
Yeah. And in fact, actually, that leads to a pretty shallow and poor latch because we're not letting gravity help us this way when we're leaning forward. So I tell people if you're going to use a breastfeeding pillow, that's fine, but the pillow is actually not for the baby to sit on, it's for
For
your
your
arm.
arms.
Yeah.
Yeah.
And then that lifts the baby up so that they're now
Yes.
near the breast. But
And so
that
that you're
being
not
said,
using your body to hold the baby. You don't want to be tied up
exactly.
in this area, right? For breastfeeding, you want to be nice and relaxed. And yeah,
Exactly, exactly. But you know what? Like that being said, you could probably accomplish that with any pillow. Like it doesn't have to be
yeah,
a breastfeeding pillow. If it's for
yeah,
your arm, like we can use a bed pillow. We could use a pillow that sits on our couch,
right.
which is often like what I use when like people come see me in the clinic. I don't keep breastfeeding pillows there. I will
Right.
just be like, we're gonna grab this little couch pillow or this bed pillow, and I'm gonna just show you how to use that.
Yeah.
Um, because the key also is that like again well in a normal world, not a pandemic world, if you'd go out and you'd go to places, the last thing you want to do is be like, I have to drag my breastfeeding pillow everywhere I go.
Yeah.
So I like to show people a position where they don't need to use that.
Well, you don't want them to depend on props, right?
Yeah, yeah,
Yeah.
yeah.
So okay, so that's great advice there. I say then if you have a friend who wants to lend hers or get rid of it, or you have you don't mind spending the money to use it, maybe just for those first couple of moments for your arms even, but like don't go out of your way investing into something when you have other props near you at home.
Absolutely. And I mean, who doesn't have a gazillion pillows sitting at home? So
Yeah.
again, that's the baby market in general. There's lots of
Yeah.
props and things that they sell that probably aren't necessary. So
Before we start talking about formula, because I want to go there next, what are your
mhm.
thoughts on like those silicone? It's like the Haka one, like you attach it to one breast while you're breastfeeding on the other one, and it's supposed to collect like the excess letdown. What do you think about that?
Yeah. Yeah. So, you know what? I mean, they are great for those situations where, like, yes, say you're that person who, when you're feeding, when we breastfeed, oxytocin is released in our body and that allows us to have letdowns. But our body doesn't know, oh, only let down on your left breast. It's going to let down on both breasts. So a lot of women will leak on the other side
Yeah.
and they might use the Haka to kind of collect that. A few things I tell people, first of all, a lot of people think or they think that's a pump. It's not a pump.
Oh,
It's a
okay. Yeah,
milk
no, I never
collector.
thought of it like that. Okay.
Yeah, so people will be like,
Like they'll
"Oh,
actually pump?
yeah," like, or they think that it's actually emptying the breast and it's acting like a pump, and
Oh,
so if
okay.
we're asking you to pump or we're involving pumping somehow, that's not a pump.
Right, right.
Um, and then the other thing is sometimes though, because it is suctioned on your breast, it can collect quite a bit of your letdown, and actually sometimes
Yeah.
that takes away from what babe could get. So when
Ah, okay.
other side, they may get fussy because they're like, oh, what's happened to that? Especially for babies who may be relying on your flow for whatever reason.
Right, right.
So you know what? It's they're great in certain situations, but
Yeah,
it depends situation by situation. And again, they're
yeah,
also something that I think are good short term. Once your
yeah,
babe gets too big,
yeah.
their feet like kick off the,
Oh, I
the thing and
know.
then it goes
Yeah.
flying. So
It's so true. Well, like my 1-year-old now, she breastfeeds like with her head there and then her body twisted and like almost hanging off of me. She's just so funny when she's feeding.
totally
Okay, let's
gymnastics. So
yeah. Let's talk
yeah.
about formula feeding. What do you feel are the biggest challenges that either you experienced and you see in others, or that you're experiencing right now because of the pandemic, in regards to formula feeding? Anything in regards to it? What are you finding right now?
So I guess a few things. I mean, I guess the biggest thing is for parents who've chosen to formula feed. Um, Number one, having to explain themselves
Yeah,
because there still is such a push to, breastfeed best and to breastfeed.
yeah,
And again, if you've made those informed decisions and that's your choice, that's your choice.
yeah.
So that's totally fine. So I feel like a lot of formula feeding parents have like they get judged or they get a lot of pressure that's not necessary. The other thing I find is so typically for newborns, we do suggest, and this is a recommendation by the World Health Organization, that if you're able to afford it, to use ready to feed formula. And so there's a
Okay,
bit of misconception because sometimes people are like, oh, I just use powdered formula because I was told that was fine, or I've brought powdered formula into the hospital. And you'll find in
right,
all the hospitals, there's never powdered formula. It's only
right.
ready to
Always the
feed.
pre-made. Yeah,
Now, yes, our water is clean. Yeah, and our water and everything's clean here. It's not the water that's the problem. It's that powdered formula isn't sterile. There can be
mm,
bacteria in it, whereas ready to feed is sterile. So for a
okay,
newborn whose tummy is so sensitive and brand new, they are very susceptible to if they get any of that bacteria, they can get very sick. So
okay.
again, obviously, if you cannot afford that, then yes, powdered
Because
formula.
is it more expensive, the
It
ready?
is.
Okay,
It is.
yeah,
So, but there's options. Like again, you don't have to buy the individual like nurse sets. You can buy like the cans, and then you can what we call decant it, which means separating it into smaller amounts and into smaller bulk.
okay, yeah. And
Yeah.
how long do they suggest that they use the ready-made until they're like strong enough to be able to handle powder if there was something going on with it?
Yeah, so for the first 2 to 3 months of a baby's
Okay.
life. Yeah, and
Okay.
then after that, they can switch, and a lot of parents at that point will choose to just kind of switch to the powdered version of whatever formula they may be
Yeah.
using,
Yeah.
yeah, which is fine. And then the other misconception is that, how like the safety of formula. So again, often if you are given formula in the hospital, they'll give you like the little nursette with the bottle,
Yeah.
and then they'll tell you to feed the baby, and they'll say whatever's left over, dump it.
Yeah.
And so then people think, oh, like, formula is only good for an hour, which is true, but that means anything the baby has touched is good for an hour. So if my baby's mouth has touched this, any milk that I have in here is now considered contaminated, and it's only good for the hour. But I tell people, like, on day one, your baby is drinking 10 mils per feed, like at the
Yeah.
most. At the
That's nothing.
most.
Yeah.
Right. So, but those nursettes, they're 60 mils. They're typically like 59 mils. So we're going to go through and waste a lot of formula,
Right.
which again, it's expensive. So we don't want to do that.
Yeah.
So
Yeah.
what I'll tell people is you can separate. So if you put 10 mils in here, the other 49 mils, if you put it in the fridge, that's good for 24 hours. And I think when
Oh,
I see a
wow.
lot of people and I tell them that, they're like, what? Because they had no idea, and they've been wasting so much formula, and they're like, oh my gosh, like I didn't know, and it's so expensive. And so
So it's good to
I think that's
get
very important
some
for
sort
people
of
to know.
small bottle for newborn feeding then to be able to just portion out, right?
Exactly, exactly. Again, while you're in hospital, they're just going to give you the
Right.
nursettes and a bunch of nipples, and that's fine. Like while you're in hospital, like if they're providing you the formula, because again, in most cases, too, people think like, should I be bringing formula in?
Mm,
And you don't have to, like, or if you're concerned, like if you're having a cesarean birth and you've heard, oh my gosh, my milk might be delayed, maybe I should bring formula with me.
yeah.
If it's necessary and needed, they will provide it to you. Um, so, and again, people then ask, like, a common question is, well, what's the best formula? And again, people often think, oh, Enfamil must be the best because that's what they give at the hospital.
Mm.
That's who just has the contract. So that's why
It's
Enfamil
all
is
about the
there. It's not
money.
that it's a better formula.
Yeah.
Um, there's pretty it's always about the money. So
Yeah.
there's pretty strict guidelines that go around formula. So honestly, I
Okay.
tell people, like, they're all pretty much the same. So
Yeah.
if you've started with a formula and your baby's tolerating it, then you can stick with that. But if you find like, gosh, I feel like this is really, bothering my baby, and I feel like
Yeah.
it's really bothering
Gassy.
their stomach, then it's
Yeah.
okay to maybe try a different brand and see if that
Yeah.
works better for you.
Yeah.
So yeah.
Oh, that's good. No, those are really great tips because I don't think that this type of information is just readily available to people's fingertips. Obviously, if they're Googling, but I mean, you're already Googling a million other things. So, it's great to know this type of information just going into birth, right? About kind of if this is an option for you. Um, what is, what would you say are
Mhm.
two things that you wish that someone like yourself going through the birth that you did in your breastfeeding journey, what are two things that you wish someone like you would know if you were to talk to kind of like your past self or the future self of someone else who's going through that?
So the two things I wish I had been told was, to focus on if you've had a cesarean birth, um, regardless of whether you're going to breastfeed or not, is that skin to skin contact.
Mm,
Because again, if you are breastfeeding, that's really going to help with the breastfeeding process.
yeah.
Uh, but why it helps with that is because it kicks in oxytocin in our body. And oxytocin is the love hormone. And I think, at least for me, because I'd had this surgery and because everything kind of happened,
Mm-hmm.
like mentally I wasn't really there, and I felt
Yeah.
initially I wasn't bonding with my baby,
Mm-hmm.
because I had
Yeah.
trauma myself that I had to kind of deal with.
Yeah.
And just simply to know that I could have just held him skin to skin, and that kind of feelings that you get without the pressure of like that, no, he has to be skin to skin so he can breastfeed. Like, no, he can just be skin to skin with you because it's
Yeah.
amazing for both of you.
Yeah.
Would be wonderful.
Yeah.
And also something that I really teach parents now is how to pace bottle feed. Because
Mm.
what happened with my son is, again, this was 16 years ago, and he was born
Okay.
in Boston. And I'd had a cesarean, and they said to me, you know, Mom, you've been through a lot. Do you want us to take him to the nursery so you can get some sleep? And I was like, that's great. Thank
Oh,
you.
wow.
Yeah, yeah. So, and that was
Sounds
only
like
16
olden
years
days,
ago.
like
Oh,
50 years
absolutely. I
ago.
know, but this is how it was, and it still happens
Not
in the
16
States.
years ago.
Yeah, it's not even like it was like that long ago, but yeah.
Wow.
And I guess, you know, at that time, he was gone from me for a while. So what I realized after the fact was he was given a bottle, and they didn't even
Mm.
ask me, and they probably bottle fed him like this.
Right.
So he just guzzled that down, got used to a bottle nipple, and then came to my breast and went, "What?" And
Yeah, there's
would
no flow to
not.
this. Yeah.
Totally. What the heck is this? Yeah, so
Yeah.
would not latch. And I had
Okay.
no idea. And it was only years later that I put it together that,
Wow.
oh, that's what happened.
Like, it was not my fault because you probably
Exactly.
blame yourself, right?
Absolutely, absolutely.
Yeah.
And so, you know, teaching parents that if you do need to give a bottle, and it's something that, like, when you know, I work at the Milton Hospital as well. So, one of the things that I teach all parents who are supplementing is how to pace bottle feed. So babies don't get used to that fast flow of the bottle, regardless of whether you're going to breastfeed or not. Because again, a baby who drinks a bottle too fast takes in a lot of air, and then we get a super fast
Mm.
baby. So,
Yeah.
you
Yeah.
know, keeping babies more upright so we can keep
Right.
the bottle more
Okay.
parallel. Most people think to bottle feed like this, you know, at
Well,
a
because that's what all
45
the
degree
pictures
angle.
and movies have shown us, right? Like,
Absolutely.
that's the way you
Absolutely.
hold it. Yeah. Yeah.
Totally. But I tell people, like, imagine I put you at a 45-degree angle and I poured a drink down your mouth. You
You
wouldn't
have no
enjoy that.
choice but to swallow. It's like
Exactly.
forced. Yeah.
Exactly. So then what happens is, you know, what I would see is a lot of babies getting overfed initially.
Okay.
And I'd walk
Okay.
into the room and parents are telling me, oh my God, my baby just like threw up a ton because they took way too much for their little
Wow.
tummy that's the size of a
Yeah.
cherry. Right.
Yeah.
So helping parents, and like, you know, again, for me would have been important to understand how much does my baby actually need and how can I appropriately give it to them. And so
Yeah.
something that I really was mindful of, and I really was, you know, trying to teach new parents about that stuff.
I think that's important because people don't realize when their baby's first born, their tummy is so tiny and then it grows as they start to mature.
Yes.
So with formula feeding, you actually have more of an idea of the measurements, and you can follow, you know, that measurement of the baby's stomach and how much you're supposed to be getting, especially with changing their position, but also only putting a certain amount in the bottle.
Yeah.
Right. And so, but with breastfeeding and for breast milk feeding, it's a lot harder because we don't know what's coming out. And so even if you're switching from back and forth, or you're supplementing and doing both, it can be really, really confusing, and not, they might not know what their baby's even getting. So
Absolutely. Absolutely. And something that I do actually tell my bottle feeding parents is that just because you're bottle feeding doesn't mean that your baby has to take the same amount every time. There's
right.
a range of how much a baby takes at a feed, and that should be this, like, that happens at breastfeeding, and that should happen when you're formula feeding or feeding pumped breast milk. Babies eat like we eat. We don't
Yeah.
always eat the same amount, right? Sometimes
Yeah.
you're hungry for a snack, so you may eat a banana, and an hour later, you're like, I'm
Yes.
hungry again. And now I'm going to
Yeah.
eat a bigger meal. And that's
Right.
exactly how our babies should feed. So I like to teach on-demand bottle feeding.
I like
Versus,
that.
yes, versus just scheduling it and like, okay, they
Time.
got to take
Yeah.
this amount every single time.
Yeah.
Because really it's important for infants and children to learn about their hunger cues, but also their
Yeah.
satiation cues, because that sets you
Yeah.
up for success later on in life. Because even as adults, some people don't recognize their own hunger cues or satiation cues,
Oh, yes. Yeah.
right? And people just keep eating, 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 and then they're like,
Yeah.
oh God, I'm too full.
Yeah.
Or you just eat
Yeah.
because you think you're hungry, but you're not, right? So
Yeah.
it's important to know that early on.
That is such a good point to make, because I feel like just because you're not able to breast or breast milk feed, doesn't mean that you give up all of the other natural things that are occurring with your baby as they're developing and as you're getting to know them, which are these hunger cues and kind of getting snacks here and there, because that's what breastfeeding is like. Their body is naturally saying, "Mommy, I just want another feed," and you're like, "Again, I just fed you." Like, but that's just because that's naturally what they're following. And so just because you're using formula doesn't mean that that natural, cues are still not there. They're there. So I think the way that you're teaching on demand makes so much more sense, and it allows your baby, it's working with your baby's body and not against. And I think that's really, really great.
Absolutely. Yeah, for sure. And again, like it kicks in all those things because again, babies feed on reflexes. That's how they know how to breastfeed or bottle feed.
Yeah.
So, and babies have a natural rhythm when they feed, which happens at the breast where they kind of suck, 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 swallow, pause, and breathe. And then they
Mm-hmm.
suck, 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 swallow, pause, and breathe. Well, when we pace bottle feed, we can mimic that on a bottle too. So we
Right.
allow babies to take those breaks. We allow them to cue us when they're starting to get full or when they need a break or when they need to burp, as
Mm-hmm. Mm-hmm.
opposed to just kind of overwhelming them with flow.
Yeah.
And then again, like I said, having a super gassy baby, because basically I explained to parents, it's like you're chugging every single time you drink something.
Oh, yeah.
And of course, you're going to be uncomfortable if you do that every time.
Yeah.
Mhm.
Oh, those poor babies. And I've
Yeah,
seen so many of them in my practice as a massage therapist working with those little infants. And they're so
totally.
gassy. And the parents are just, like they just feel so bad. And nobody wants to feel like they're, hurting their child. And, they want to make sure they're doing the best they can always. And I think, this information should be mainstream, and it's not. It should be even like on the, like, the bottle, or on the formula can. This
I
should be
know.
there. It should be like,
Oh,
this is,
easily
go
accessible for everyone.
right, watch this video. You're not supposed to put your baby flat. They're supposed to be more upright those first at least couple of weeks or couple of months, right? Because eventually I'm sure it's, once they have more control, I'm sure it's okay to have them more flat while they're feeding and not.
Slightly, but I really
Yeah.
do have, people kind of keep them more upright most of the time
Okay.
because
Yeah.
it just is it's how we drink also. We don't
Right.
sit back
No.
and drink, right? So
No. And that's so good. Like we need to change that conversation then, because stop creating pictures online and posting this stuff where there's babies laying flat drinking out of something, because it's just not natural.
totally.
It's
So
not how they need it.
no, again, you're right. And so again, like, even when you mentioned about like those super gassy babies and those uncomfortable babies, unfortunately, a lot of parents start thinking like, maybe it's the formula, maybe if I'm breastfeeding,
Mm,
something I'm eating.
yeah.
And I tell people, actually, the first thing we need to address is let's see how your baby's feeding.
And see,
Are
I
they
never
feeding
thought of
there?
that, because of
Mhm.
all those gassy babies came in. I was like, maybe it's something you're eating. Maybe it's the formula. Like I said the same thing, because I
Totally.
didn't. I've never, formula fed a newborn. My son did take formula kind of like later on, closer to 1 year, when I had to go back to work and wasn't able to pump.
Mhm.
But I never fed him, myself from a
Yeah.
bottle, so I would never know.
Yeah, totally. And again, right? I mean, absolutely, those can be the cases where it could be
Yeah.
something you're eating or the formula.
Oh,
But again,
yeah.
the
But
first
to
thing
think
I
about
always tell
doing
people,
that,
yeah,
yeah,
assess a
yeah,
feed, because really, truly, a lot of the times that's where it's starting.
yeah.
And then we can kind of go from there. So that's definitely something that a lactation consultant can help with. And again, not every lactation consultant helps with bottle feeding, but it's something I definitely help with. So
Yes.
yeah.
Well, everyone should come and see you, because you are definitely an expert in this. You have the personal experience and the professional. And I think all those things combined, really your passion just like it beams out of you. And I'm so happy that we had this conversation. Thank you so much for being a part of this to help contribute towards Cesarean Awareness Month, and not in a way that, cesareans are negative or it can be a bad experience, but that we can empower knowing more about cesareans and about, all these things that have to do with your fourth trimester, really, which is after the baby's born and you're adjusting and you're healing and all that. So how can people get in contact with you if they do want to work with you either virtually or in person?
Yeah, so the best way is either they can follow me on Instagram at Happy Baby Help, and or they can find me on my website, which is also happybabyhelp.com, and they can send me a message right through there, and my phone number's on there too. So any of those ways are a great way to get in touch with me, and happy to help. And again, biggest thing is with no judgment at all.
Yeah. Yeah.
Really just to be able to empower parents to make the best decisions for themselves.
And that's what it's all about, is just empowering, because it doesn't have to be coming from your doctors, your midwives. It can be coming from other practitioners. We're out here, we're trying to help, we're trying to get that information across. So like I said, I hope one day that there'll be this type of information on the label of the products that they're buying, because that would kind of make sense, right?
You would think.
Well, thank you so much for joining us tonight. And I'm going to link Anita at the bottom of this post. And I hope you all enjoyed as much as I did chatting with her.